Hello, welcome back to the Politics Hub. Well, the waiting list for routine hospital treatment in England has risen for the second month in a row. That means the backlog for hospital care now stands at an estimated 7.6 million treatments. And it comes as the new Health Secretary has ordered an independent review into the performance of the NHS. Wes Streeting says he wants to be told the hard truths about what he calls a broken service. I spoke to him a few moments ago. Good to see you. Good to have you on the programme today, and congratulations on the election result as well.
Thank you.
You are launching a warts and all review of the NHS. What's the idea?
I think sunlight is the best disinfectant, and it's really clear to me that the NHS is broken. The issues that we've been talking about during the election campaign, the waiting lists, ambulances not arriving on time, people queuing around the block to see a GP, not being able to find a dentist, all of that is evident. But I felt, going into the Department of Health and Social Care in the last week, it's a bit like walking into a house that you can see is in a complete state. And what I've asked Lord Darcy to do is take up the carpet, look at the floorboards and tell us how bad things really are. And there's a central principle here, because as well as the immediate steps we've been taking, and I've been taking in the last week to deliver on our promises, we said we would deliver a 10-year plan for the NHS. Work's already underway on that at pace, but I think a crucial foundation is, you know, and who better to ask than a doctor on this? If you want to provide the right prescription, you've first got to get the right diagnosis for the patient, and that's what Lord Darcy is doing, and he's got 30 years of experience, more than 30 years of experience in the NHS on the front line.
You say that the NHS is broken. I was quite intrigued by Jeremy Hunt's speech after he kind of managed to cling on unexpectedly in his constituency, because he said this about Labour. He said, I hope in particular they use their majority to make much-needed reforms to the NHS in a way that is sometimes difficult for Conservative governments to do. And it felt to me like what he was trying to say there is the NHS is broken, there are some hard truths that we need to kind of front up to in terms of reform, but because Labour's more trusted on the NHS, it's easier for Labour to do that. Do you think that's true?
I think it's true that people don't trust the Conservatives with the NHS, and who can blame them after the state they've left it in. I think it's also true that people know that Labour's values run through the DNA of the NHS. We created the NHS. We love the NHS. I mean, the NHS saved my life when I went through kidney cancer. It's been there for my family when we've needed it. Sometimes it hasn't been there when we've needed it too. So it means a lot to me, and it means a lot to Keir, it means a lot to the government. But we've also got to make sure that we're not dewy-eyed and sentimental about those challenges. And I was really encouraged last week when I said, look, the policy of the government is now that the NHS is broken and we've got to fix it. I was inundated with not just patients, but people who work in the NHS saying, finally someone's going to be honest about what we're going through, what we're living through.
But I guess, you know, he's talking about the reforms as well, isn't he, right? Not just the diagnosis, but also what you do about it. Like, for example, is it easier for a Labour Health Secretary to talk about the private sector being involved in certain ways in the NHS?
Yeah, well, I mean, I've said we're going to use the private sector's spare capacity to bring down NHS waiting lists, because it's both the pragmatic thing to do. If there's spare capacity, why not use it? It's also the principled thing to do, because we've got a two-tier system that's opened up where those who can afford it are going private and those who can't are being priced out and left behind. And my Labour principles say that working-class people deserve the same quality, the same access to services as people from wealthier backgrounds, and so I think this is the principal thing to do. I also said this week at a conference hosted by Tony Blair that I want the Department for Health and Social Care to be a key driver of economic growth in our country, and whether it's helping people to get back to health, which will help lots of them get back to work, or whether it's partnering our NHS with our incredible life sciences and medtech sector in this country to drive and power this technological revolution here in Britain, or whether it's making sure that we're thinking about the NHS and social care as employers in every community in the country and how they can act as economic anchor institutions for good jobs and growth that's evenly spread. There's a big role for us to play here in helping the Chancellor to achieve the #1 mission of the Labour government, which is get our economy growing again.
One of the key challenges that you've got right now is the junior doctors' strike. Give us an update on those talks. You're meeting them next week again, aren't you?
Yeah, so I said we wouldn't waste time. I rang them on day one. I had them in the department on Tuesday this week, and we were meant to see each other for half an hour. We were there for an hour, and I was mainly there to say, look, tell me how this has gone wrong, why the relationship broke down so badly with the last government, and what we can do. And they're coming in next week, so we want to keep the momentum up and give junior doctors the confidence of knowing that their government will treat them with respect, unlike the last government.
They want a pay rise of 35%.
And they've also said, to be fair to them, that they're willing to negotiate. And in that spirit, we're entering this process in good faith. I'm genuinely angry at the way that junior doctors have been treated. I was shocked to learn this week the last time a health secretary met with the junior doctors was in March this year. We had strikes the week before the election in July. What on earth were they doing in that government, not meeting junior doctors for months ahead of strike action? That's how seriously they took it. I phoned the junior doctors on day one, I had them in on week one, and I'm going to be seeing them again in week two, and we will work together until this is solved.
What the previous government would say is that they did manage to get pay deals agreed with other parts of the NHS.
Well, they presided over the first national strikes in the NHS's history,
Okay.
and you know, we certainly did have national strikes under the last Labour government.
Let's look forward. Another issue that I want to talk to you about is the current cap on child benefit. Children only able to get child benefit. Gordon Brown says it's pushing children into poverty, so does the Resolution Foundation. And yet, I guess I'm particularly interested to talk to you about this because of your own upbringing as well. You know, you've talked about growing up with not much money, with a single-parent family. I think you had, 6 brothers and sisters, is that right? So you know what it's like to be a large family with not much money. Are you personally comfortable with a cap?
No, that's why I've voted against it when it was brought in. What we've got to do on child poverty, and Liz Kendall's working at pace on this, is to make sure we've got a serious cross-government strategy for reducing child poverty in this country, just as the last Labour government did. And what's different now to when we were last in government is so much of that poverty affects families who are both in work and in poverty. Now, we said before the election we wouldn't make promises unless we could keep them. We wouldn't make promises unless we knew the country could afford them. I think people are going to have to bear with the government on a whole range of fronts as we try and clean up the terrible mess the Conservatives have left.
You know, back when you were a child, you got family income support for each child. There wasn't a limit. In the 1980s, Margaret Thatcher actually gave some above-inflation increases to it as well.
Well,
talking to you, it feels to me like you don't feel that comfortable with it.
Well, bear in mind that Bridget Phillipson, as our new Education Secretary, is getting to work to make sure we have free primary school breakfast clubs in every primary school, so kids start the day with hungry minds, not hungry bellies. The Deputy Prime Minister's work to deliver
1.6 million kids affected by this cap.
Well, and delivering the homes that people need and the installation in those homes so that we can reduce people's energy bills. Ed Miliband, as the Energy Secretary, switching on Great British Energy. There will be lots of things that this government does to directly attack the root causes of child poverty. And one of my proudest moments in the last week was being sat around the cabinet table with the most state-educated cabinet in our history. You've got a Deputy Prime Minister, an Education Secretary, a Health Secretary who've all experienced child poverty growing up and are absolutely determined to work with each other and with our colleagues right across government to reduce child poverty in this country. Okay. And Liz Kendall is passionate about this work. So is the Chancellor. And we will attack child poverty in this government just as the last Labour government did.
Finally, I've got to ask, did you watch the game last night?
I did, but I'm not. If you're going to start asking me about bank holidays or the final, you can forget it, because I'm not saying anything to jinx it. All I would say is that the England football team has a better record of bringing trophies home under a Labour government. So let's have everything crossed for Sunday.
Is it coming home?
I'm not jinxing it. I'm actually bricking it about Sunday's final. I've not felt this excited about the Euro since Euro '96. So I just hope they don't I could do for my own health and for the nation's health without the heart-straining drama of last-minute goals.
Yeah, I'll take it if it's an hour and if it goes to us, though.
Yeah.
Thank you very much indeed. Good to have you on the show.
You.